Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss my topic that is disorders affecting formation of platelet plug. There are the thrombocytopenia. First disorder is the thrombocytopenia. The physiological that is found in newborn menstruation, and next is the pathological decreases the marrow production, tumors, fibrosis, aplasia, drugs, thiazide diuretics, splenic sequestration, splenomegaly, increased destruction that is autoantibody formation, aspirin, insecticides, cardiac valves, sepsis, vasculitis. Next is the functional platelet defects, disordered adhesion, von Willebrand's disease, VWF. There are decreased factor VIII activity and increased BT, that is most common hereditary hemostatic disorders. Next is the disordered aggregation, thrombocythemia, Glanzmann's syndrome is also known as afibrinogenemia, disorder granules release. There are the Chereck, Higashi syndrome, cardiopulmonary bypass, myeloproliferative disorders, aspirin and other NSAIDs is used for their platelet count. If there are the less than 1 lakh, it is the asymptomatic normal bleeding time. 5,000, there are the 50,000 to 1 lakh is equal to the bleeding occurs after severe trauma. Bleeding time is slightly prolonged. If less than 50,000, easy bruising manifesting by skin purpura after minor trauma. If less than 20,000, there are the spontaneous bleeding, usually have the petria in Karnal spontaneous bleeding. Next is the hereditary disorder. Factor VIII deficiency is known as the hemophilia A and factor IX deficiency is known as the hemophilia B. So there are factor 10 is linked the recessive disorders. Factor 11 deficiency is known as the autosomal recessive. Acquired disorders, vitamin K deficiency, there are the liver disorders, fall in all the factor except factor 8. Disseminated intravascular coagulation, acquired antibodies against clotting factors. There are the transmission of hemophilia, normal male and the carrier female. There are diseased male and carrier male. In today's class, I discussed about the disorders affecting the formation of platelet plug. Thank you for watching.